be primarily focusing on 4 or 5 areas just to set the discussion. Of course, on the top of line will be how public policy is formulated in Pakistan and how COVID-19 has impacted positively or negatively the public policy in Pakistan. And thirdly, the healthcare system in Pakistan and the impact of COVID-19 on healthcare system, impact of COVID-19 on Pakistan's economy, and the way the government of Pakistan has handled the situation to come out of a dire situation and moving ahead. And then, of course, its impact on society and all that. My main focus will be to link all these things with the formulation of public policy and its processing, formulation, and implementation. And the way could we achieve more in the domain of public policy, or we were not able to achieve results. So this is the whole scenario of my discussion. So I mean, it is no way to tell the practitioners of public policy that public policy is nothing else but generally it consists of the set of actions, laws, and behaviors adopted by a government or more governments to address public issues, provide them basic amenities of life, and look after their welfare in everyday life. If that is the yardstick, then let me also add and supplement that each country has sometimes more than 30 plus policies, which are almost all inclusive and all embracing. And the main purpose of all such policies is to provide maximum facilities, amenities, and benefits to the people of their country. So for all practical purposes, any policy, if it is people-centric and looks after their welfare, then it is a good policy. And we will be looking at plus and minus points of policies, especially public policy, and then heading to other direction. In Pakistan, according to the Constitution of Pakistan, public policy is formulated by the executive branch of the federal government, and then of course its processing, its implementation and formulation all had been done in the past on 2 levels, because Pakistan had a mixed history of civil and military governments. So most of the time our policies, you talk about any policy, especially public policy, was tailored, processed, implemented, and carried forward by single entity, that is either the civil government or the military government. So more emphasis in the beginning was one window operation, but subsequently there was a very clear understanding and awareness in once the democratic government started coming in, and in under democratic dispensation, other stakeholders were also involved in the processing, formulation, and implementation of the public policy in Pakistan. Having said that, the next important point in my talk is and should be that we are no more in a stereotype mode of public policy or governance. Now we are passing through different phases where we are simultaneously talking about, say, governance, lack of governance, good governance, or the new governance. All that new paradigms are gradually, incrementally taking their roots in the processing, formulation, and implementation of public policy of Pakistan. With that very short introduction, let me come to one main fundamental question: how has COVID-19 impacted public policy in Pakistan? Professor Kingsley Hans has very appropriately covered this fact that coronavirus or COVID-19 was something novel, new, mysterious, unpredictable, non-understandable, and the world was at loss to understand this pandemic in the beginning. No matter, there were clarion calls coming from different sources. Ebola was one of them. MERS was one of them. SARS was one of them. If I just remember Bill Gates' TED Talk of 2015, wherein he has given a very loud and clear warning to the entire world. Wake up call. If you don't make vaccines right now or in the next few years, the next pandemic is going to kill more than 10 million people. So let us work on vaccine. But forgetting about that preparation part, the world focused on the past history, not looking at 2,500 histories of multiple pandemics which have disturbed the world. And they primarily focused on, well, Ebola has not caused so many deaths. SARS and MERS were also not fatal to the mankind. So they left that thing there, and we are still thinking what is going to happen in making of a vaccine. 6 months, 18 months, 24 months. Experiments are going on, but not a practical thing has come yet out. So under that mixed, confused scenario, we in Pakistan has also different voices coming, divergence of opinion, both at federal and provincial levels, to mitigate, address, and fight against this coronavirus. So in public policy domain, I found a very clear lack of understanding and coordination at different levels of provincial and federal government. Then, of course, second important facet was resistance coming from different strata of society, coming with different voices, thus hampering all the attempts of the government of Pakistan to address in the beginning especially this huge pandemic in an appropriate way. Then mistrust was prevalent in the society. Some people, there were different clusters in Pakistan, well-educated people, semi-educated people, illiterate people, and those who are living in far-flung areas, villages, even making question, what is coronavirus? Show it to us. Since it is not an entity, it don't have an embodiment or body. So what you are talking about? So these are different levels of understanding, and a huge mistrust was at play during this whole thing. And that also gave birth to confusion, enormous confusion in the beginning. And things were topsy-turvy. Look at the example of just lockdown. Sindh province was very effective initially in putting a curfew-like lockdown, whereas the central government and Prime Minister Imran Khan were initially against the policy of lockdown, just because they were looking at the demographics of Pakistan, concentration of overwhelming majority of the population who were living in villages, those who were illiterate, those who were daily wage earners, how they can survive if things are locked down, cities, big cities, small cities and villages are locked down. So the central government was all the time mindful that a complete lockdown or curfew-like lockdown is going to disrupt not only the economy, but everyday life of the poor people, low-income groups, and different strata of society. And then, of course, in another province, that is Khyber Pakhtunkhwa, there was a policy of partial lockdown that was also partially, implementable. People were still defying. They were not ready to accept the dynamics of a lockdown. And then, of course, later on, when things started settling down, we came to the next level. And right now, especially in the last 2-3 months, we are having a policy of smart lockdowns, putting specific areas or sectors or blocks of a big city which is in red zone of spread of pandemic, and then trying to relax other areas nearby or far away, not to bring them even under smart lockdown. So all these have their positive impacts, but with the caveat that initially we were caught unprepared even in the implementation of our lockdowns. Then of course, again, a big question in public policy and handling of resources, how to manage testing, tracing, and isolation of the people. There were varied opinions. I mean, initially we were at loss to understand the dynamics of the pandemic, and we were looking how to convince the people to be mentally prepared for, tracing, testing, isolating. And then a huge problem in behavior of educated, semi-educated, illiterate people to combine a wholesome, to make a wholesome approach, a holistic approach to deal with all strata of society at different levels in the country was an uphill task, mostly remained unachievable in the beginning. And then gradually, of course, with the passage of time, we came to understand the dynamics, and now we are in a much better position. That is why, I mean, pandemic started in Pakistan, the early cases by the end of February. And March we were having, beginning of cases, but very low numbers. And then next 2 months were, more cases. So by now, when we are in July, it is something, I mean, which should be, whether it was prudence or some policy implementation or some measures taken by the government, that death rate in Pakistan is still 5,600 deaths plus minus. And likewise, infection cases are 160,000 plus, not more than that. So that shows a country of 220 million population had managed the pandemic initially with a great level of difficulty, then a little easiness, and now in a better position. So all these are related one way or the other with the policy itself. How is healthcare system affected in Pakistan? Let me start by saying that economy of Pakistan or public policy of Pakistan are now handled at two levels. One, of course, is federal. Second is provincial level. And especially after the 18th Amendment in Pakistan, most of powers related to public policy or all other domains have been devolved and delegated to the provincial governments. They are responsible for the preparation of their budgets, economic allocations for different phases of life which are required, and then implementation itself. Likewise, even in healthcare, this is right now a subject within the domain of the provincial governments, and center has to take supervisory role or coordinating or regulatory role on the top, and sometimes provision of more facilities and resources to the provincial governments. If I look at, broadly speaking, the existing healthcare system in Pakistan, I mean, this is no hiding from anyone that average spending on healthcare system in Pakistan is almost 2 to 3% of our GDP, which is, of course, as compared to developed at other, fast developed countries or developing countries, somewhere their GDP ratio is 10% at least. So we are not in the bottom. we are at the lower end because of other overwhelming priorities of the government, especially on the top of that, which is sucking resources, is our loans and debts, international loans and debts, and servicing of debts, and repayment of debts. And then, of course, second important facet is expenditure on the armed forces. Then, of course, all other things come later on. So that is our history of 72 years that on healthcare, Pakistan has invested relatively quite limited amounts of its GDP and annual budgets. That is why we were facing an uphill task in the beginning, because healthcare system of Pakistan was not sustainable because of limited fundings. And then COVID-19 itself was a huge challenge, which really put us under stress. And I will let you know how we overcame that problem and through what efforts and agencies we were able to take care of all that. But it is true that having all these problems initially for focusing on the healthcare system, ultimately we evolved a mechanism under which we were able to control and contain and mitigate it even within our health system by getting support from different sources, international agencies like IMF, World Bank, Asian Development Bank, G20, and this is just a few, on their suspension of payments of on loans and all that, and additional funding coming from different sources to add up the efforts of government of Pakistan in healthcare system. This is no comparison, but let me put across my point here that under these stressful and testing times, you will bear with me and agree with me that the entire world's healthcare systems were under tremendous stress. Number one, on the level of preparedness. Number two, on the handling of the epidemic itself. Hospitals were overwhelmed, choked. This remained case in the beginning in Pakistan. We were not having capacity in our hospitals, and the government has to establish and create some new hospitals specifically meant for the treatment coronavirus and cases, handling of cases and all that. We were running short of supplies. I mean, there was no concept of masks, sanitizers, ventilators, and other equipment, which we were able to tide over by consistent efforts of the government of Pakistan by getting all these, related materials and equipment from China and other countries. But initially we were having helplessness and unpreparedness. And I was looking, the world was at loss. Healthcare systems of the world were under stress and under pressure and overwhelmed. And there was uncertainty prevailing most of the time. And then gradually we came out of that whole scenario. Then, of course, other than COVID-19, Pakistan was facing some traditional problems and vulnerabilities and localized epidemics in the past, like dengue and measles and hepatitis C, and a large number of Pakistani children missing vaccination and all that. So these were separate problems which were already rolling up. But at the same time, COVID-19 pandemic brought a new series of problems. Early warnings of coronavirus were not appropriately heeded to, as I pointed out by giving just references of Ebola, SARS and MERS. And even we didn't learn anything from the movie Contagion. We didn't learn anything from all that literature which was coming even right after Spanish influenza, Russian influenza. There are plethora of books and literature, giving us dire warnings. Something big is going to happen in the world and systems will choke and collapse. So exactly the same happened. But perhaps COVID-19 has now given us new awareness and the way we should look at different dimensions. Our economy was also, my next point, was under tremendous pressure. And that pressure was because of our vulnerabilities, economic vulnerabilities. Those were, supported, reinforced by huge help coming from IMF, World Bank, and other resources, which I have just touched upon. The growth rate of Pakistan GDP in the last 5 years were somewhere between 4.5% to 3.5% in 2019. So this is track record of 5 years. But what happened after COVID-19? We were initially projecting that economy GDP growth will be somewhere around 1.8%. But that was the initial projections. Now we are talking about decline and contraction of the economy, and GDP somewhere touching minus 0.4% by the end of 2020. When I compare this contraction with contraction in big countries like United States of America, mostly European countries, they are now talking about 10 to 15% contraction in their economies and impact. So this impact on economies is going to be vitally huge, no matter it is for United States of America, Europe, third world countries, African countries, and least developed countries. Each country will be having its specific experiences in the domain of impact, negative impact on economies. So we should be getting ready to face both the best or the worst. Under the given situation, perhaps the worst. Coronavirus or pandemic or COVID-19 is going to stay for us for quite some time. There are no early predictions of the pandemic coming to an end. We have to reinvent, revise, rethink, re-understand the whole dynamics of COVID-19, its impact, its effects on countries and bigger picture, and then evolve our all policies, especially public policy, accordingly. Do I have time or should I conclude?
Sir, kindly conclude in 2 minutes.
Okay. So, but let me put one point very clearly, that the government of Pakistan handled the situation, both federal and provincial levels, with quite a good success. And all the measures taken, even with divergence of opinion, were successful at the end of the day. And now we are looking what is going to happen in the future and how we should be prepared to cope with the coming scenarios, situations, whether it is for healthcare system or economy or our everyday life, what is going to happen with the common citizen, low wage workers, our industries, our joblessness. So all that debate has started in the mainstream politics and also in institutions like my institution and all other institutions in Pakistan. But of course, this should be a wholesome exercise only and only if we learn from COVID-19 that a global pandemic was not receiving global response. There were divergent opinions coming, whether I talk about the United States of America or China or Europe and others. And if we are now thinking to address COVID-19 under a set of policies in our silos and in our compartmentalizations without sharing or adopting a global approach, I am afraid we are going to miss the train. So my conclusion remarks are, let us join our heads and hands and look something which is going to result in some sort of international and global cooperation. Let us try to put aside different sorts of wars. And you know better than me, whether these are trade wars, hybrid wars, cyber wars, put them aside like we are looking at, there are least incidents of terrorism. We are not talking about hotspots or war zones or conflict zones. If now we are talking about primarily in terms of a system which is going to emerge under coronavirus. So our approach should be looking at all dynamics and then evolve a holistic international global response so that everyone can benefit. If we think you, not me, us are them, then ultimate result will be perhaps a much bigger calamity in the form of the global warming or so many other things. Thank you so very much for your patient list.